It always wonders you why you get a specific talk assigned. Does that mean that you are having the best experience with it or the worst? Everybody knows that I'm not English first language, so I had to Google what fuss means and what little tube means. And it seems to be a display of unnecessary excessive excitement. So if you see this, are you excited? I know at least one person in this room who thinks this is not exciting but daily basic requirement. So this costs $239,000. If you take the coupe, if you take the convertible, it's $263,000. Who thinks this is a lot of money? I think it's worth it. And the best news is you could actually get both of those. 2017 model, if you compare it to what a ureteral injury costs, $480,000 for the 2013 model. So when we look at ureteral injury, that is a significant problem, even though it's not very frequent. The average payout here in this study was $346,000, and it ranged from $25,000 to $995,000. The most common cause of malpractice in colorectal surgery is A, failure to recognize a complication in a timely manner, and number 2 is damage to other tissues, to surrounding tissue, and that includes the ureter. So what are we actually dealing with? Here, those are the little tubes. And they travel in the retroperitoneum, they cross the iliac vessels, a little bit medial to where the internal iliacs go off. They travel to the lateral pelvic sidewall here, and they eventually reach the bladder. The gonadal vessels obviously have different origin or destination. The vein goes here to the cava, and the artery comes from the aorta. And so it takes a little while until they actually conjoin and then cross the ureter, at which point where we usually see them, they're lateral. Here are areas of concern for us. So A, where we interfere with the IMA, and B, as we also descend into the pelvic